A famous 90-day fiancé duo have opened up about their baby's RSV diagnosis and ongoing recovery. David Toborowski and Annie Suwon met while David was on a trip to Thailand. David was going through a tough time personally and financially, but quickly fell for Annie. After spending time together, they got engaged within 10 days. David and Annie have a 24-year age gap, and first appeared on season 5 of 90 Day Fiancé in 2017. The couple faced many challenges after moving to the United States. David struggled with money, and Annie found it hard to adjust to a new culture. Despite setbacks, including David borrowing money to pay for the K-1 visa, they stayed committed. Over time, David found steady work, and Annie started cooking classes and catering. As their relationship grew stronger, David and Annie appeared on multiple 90 Day Fiancé spin-offs, such as Pillow Talk and David and Annie After the 90 Days. They became fan favorites for their humor and honesty. Annie also focused on becoming a U.S. citizen and improving her English, while David supported her throughout. David and Annie weren't always certain they wanted children. Early in the relationship, Annie joked that having a baby wasn't serious, while David, already a father of 3, pointed out that his vasectomy would require reversal before he could try again. As time passed, Annie admitted that she had baby fever. By late 2023, they were seriously exploring IVF and fertility options. David and Annie began their IVF journey with public updates starting in early 2024. Annie underwent an embryo transfer on June 26, 2024, which she described as successful in an Instagram post. The couple shared ultrasound photos and milestones openly and announced the pregnancy on July 5, 2024, thanking fans for their support during the process. Medical challenges included PCOS for Annie and a prior vasectomy for David. Because of his vasectomy, sperm had to be surgically extracted to fertilize Annie's eggs. Their transparency helped demystify IVF procedures and highlighted both partners' medical efforts to grow their family. After the embryo transfer, Annie and David moved to Thailand to continue the pregnancy. They chose to stay there for better medical care and so their baby could have Thai and American citizenship. The move also brought Annie closer to her family. Their IVF journey showed how much planning and effort they put into becoming parents. Minthira was born on March 11, 2025, in Pattaya, Thailand, weighing 6 pounds 9 ounces and measuring 19.3 inches. Her name, Minthirarad, means brave gem, reflecting the couple's excitement and joy. David and Annie publicly celebrated her arrival, expressing gratitude to the medical staff and fans who supported them throughout their IVF journey. Minthira had her first checkup a week after birth at Bangkok Pattaya Hospital. Annie said both mom and baby were doing well. David shared photos of the visit and joked about getting used to diaper duty. The couple seemed happy and relaxed in their social media posts in the last few months, enjoying their early days as new parents in Thailand. On July 10, 2025, David shared a picture of a distressed-looking Annie holding Minthira in her arms at the hospital, with a different picture of an oxygen mask attached to the baby's face by a medical professional. David wrote, "I am asking for all our prayer warriors tonight." David added that Minthira was going to remain in the hospital for the next 5 days, even though Annie had received a vaccine for RSV when she was pregnant. Respiratory syncytial virus, RSV, is a common infection affecting the lungs and breathing passages. Mayo Clinic states that nearly all children catch RSV by age 2. Adults and healthy older kids usually get mild cold-like symptoms that can be managed at home with rest and fluids, needing little medical care. For most healthy adults and older children, RSV causes symptoms similar to a common cold, such as a runny nose and cough. These mild symptoms usually improve without treatment, and simple self-care helps ease discomfort. Serious problems are rare in these groups but can happen with weakened immunity or existing illnesses. RSV can be dangerous for some, especially babies under 12 months, premature infants, older adults, and those with heart or lung diseases. People with weakened immune systems are also at higher risk. In these cases, RSV can cause severe lung infections that may require hospital care. David has since posted daily updates about Minthira and her recovery at the Bangkok Pattaya Hospital. David told his followers about the doctor, informing them that Minthira's condition was going to get worse before it got better. Her phlegm and mucus were being suctioned out. She received her medication and oxygen every 4 hours, and her fever had gone down. On July 13, 2025, David shared a sad update about Minthira. Her fever returned, her cough worsened, and she stopped eating. She was given an IV after being taken to the treatment room. David asked fans for prayers, expressing hope in Minthira's strength. 90 Day Fiancé fans continue to wish her a fast recovery.